PDA is for Peds.com.
So today we'll review the PDA version of the Pediatric Clinical Practice Guidelines and Policies from the American Academy of Pediatrics. This application is available through the Pocket Reader, which in turn is available for both the Palm and Pocket PC platforms. In this video, we are going to see the Pocket PC example. One thing we need to pay attention to before we go into the details is that it's a special format of Pocket files, so it's not going to be listed in the library of the Pocket Reader. So we can see here that's not listed, the pediatric guidelines. Instead, we have to go to the file itself and open it. So we have to go to the place where we have copied our file after being downloaded from the website or from the book or from the CD that comes with the book. And in this example, I'm going to go to open File Explorer, and then I know that I have copied the file to my documents. And in my documents folder, I scroll down to find the file, which is called PCPG, Pediatric Clinical Practice Guidelines. Here's the home page, and you have links to all the available resources in a user-friendly Pocket interface. Let's go and try the Clinical Practice Guidelines, the first link. And right away, we can see that the interface is different from the other Pocket files. We have here, for example, on the right lower corner, previous and next arrows, which is not seen in other Pocket files. You have lists of all the diseases included. Here, for example, the jaundice guidelines, and within the jaundice you have links to abstracts, full text, and some other useful tools within this application. Let's go and see, for example, the treatment guidelines of jaundice, and we can see that within the text you have appropriate links to tables and figures and other useful tools. Of course, you still have all the functionality of the Pocket Reader, like, for example, you can increase or decrease the font size, and also definitely you have a search function. Here is another example, febrile seizures. Let's now see the abstract page, which is in fact a summarized form of the extended full text guidelines. Back to home page. Let's try the recommendation summaries. And again, you have the list of all the diseases. One thing we need to notice here that these diseases, the list of these diseases is not extensive. This is less than what you have on the book. But certainly these are the diseases that are commonly encountered in clinical practice. You have also algorithms. For example, here, the management of acute otitis media. And here is the algorithm in a yes or no fashion. And so you don't need to confuse yourself whether to wait or not to wait, and whether to give antibiotic or not. You have the AAP recommendations right in the palm of your hand. Another great tool here is the bilirubin risk assessment. You just enter the age in hours, and you will be taken to the normal ranges. One thing we notice here is that you cannot enter the age in hours in a 2-digit format. You have to enter it in a 3-digit format. So you have to type in 040 for age 40 hours. Here we have links to the level of bilirubin in your patient. For example, if it is 7.8 to 9.9, it is a low intermediate risk. And even you have a link to the complete plotting chart, the bilirubin normogram, in a form of an image that you have to scroll side by side and up and down. Let's start over again, and let's try the 12 hours age. And very useful here that we can change the units from milligram per deciliter to micromole per liter. Back to home page, we have also ICD-9 CM coding, but these are limited to the diseases which is included within the application, so it's not an extensive coding application. We have also patient education and guidance. Ever wondered what to tell your patient or his or her parents about UTIs in children? Here you have it right within this application. And also included is the latest ACIP 2009 immunization recommendations. For example, here ages 0 to 6 years, and you have it in a text version, for example, and within the text version you can navigate by age or by vaccine. Let's navigate by age, and we can see here a list of recommended immunizations at each given age. If you navigate by vaccines, you will be taken to the details about each individual vaccine. And also included within the immunization section is the schedule itself in the form of a large image which does not fit into the PDA screen, so you have to scroll it right and left and up and down. And there is also a section explaining how these recommendations were actually made and how to interpret them. However, we can see here that this application does not really fit into the multi-pocket reader. We can see here that the right border, the text is going out of screen, and also the bottom links here, they're very small and not easy to tap. So we suggest to have this great evidence-based reference for other medical readers, like for example Skyscape or Unbound Medicine.